caring, committed, proud of East Texas. You're watching KLTV 7 News.
Well, good evening and thank you so much for being with us tonight. Since March, folks have been asked to stay home when possible and limit their contact with others. And while it may be something new to most of us, those fighting cancer were already doing it. And with the Christmas holiday just days away, doctors at Texas Oncology are reminding you to do what you can to protect those most vulnerable.
This is a special year. We don't have to do all the things that we do every year. We'll be okay.
Dr. Priebe is with Texas Oncology in Tyler. She says while you may want to visit with loved ones fighting cancer this Christmas, it's far too dangerous.
It makes it tricky to be absolutely safe because we all come into contact with different people every day. And because the rates of COVID in the community have risen so much, it's just statistically increases your chances of coming across someone who has COVID and getting infected.
The American Cancer Society says those fighting cancer are at a higher risk for getting the virus, and infections can be more serious than in people who don't have cancer.
You know, cancer patients are especially vulnerable to COVID-19 in terms of severe complications and increased death rates. We know that data coming out of China and Europe showed that they had at least twice the death rates of patients without COVID-19, sometimes approaching in the 40% range.
And while Dr. Priebe does not recommend seeing those with cancer in person this holiday, she says virtual visits are a safe and fun way to see your loved ones who are most vulnerable to COVID-19.
We are so close to getting ahead of the virus that please just wait it out a little bit longer. Don't do anything that would contribute to spreading the virus, or for sure that would contribute to your precious loved ones contracting the virus and doing poorly with it. You have to protect them. It's your job to protect them.
And when it comes to vaccinating cancer patients, the state says they'll be in the next group of folks to be vaccinated after frontline healthcare workers and those living in long-term care centers.